Hopefully you clicked on this video because you're interested in stem cell therapy. I'm here to share with you my experience getting stem cell injections, specifically in my knee. I have been looking at stem cell injections for many years now. It always seemed like the cost was preventing me from moving ahead with it. My surgery involved arthroscopic surgery into my meniscus where they repaired the meniscus. Now, I was very active when I was younger, especially 14, 15, and I never gave it the time to probably heal as it should. It tore again or it just got worse. I'm very active. I've been a snowboarder for over 20 years now, and I've always had problem with pain, swelling, discomfort, especially after a long session of activity or multiple days of activity. The idea of getting another surgery to have them go in and potentially repair something and still feel the same way did not interest me. So for a few years, I've been looking into stem cells, and I heard that it was in the tens of thousands of dollars, which wasn't really an option for me, as I could still do my activities that I love, like snowboarding, biking, but I was never what I thought was 100%. It always felt like I was only operating at 80, 75%. To deal with this pain, I always wore compression sleeves, and I would ice for many hours a night when I got home, whether it's a long day at work or a long day at work and snowboarding. I'm usually on my feet at work, so icing, compression, elevation, and lots of ibuprofen, which can't be good for my health in general. So in order to avoid surgery, in my mind, the logical solution is to rebuild what I already have. Now, I take all sorts of supplements, whether it's a multivitamin, glucosamine, fish oil, magnesium, plant protein-based powders, and collagen. I try to stay hydrated all the time. I've been doing physical therapy, exercises on my knee as much as I can, literally for the past 20 years. Nothing's really gotten better. I just kind of push it off, just keep going, ignoring the pain, ignoring the symptoms. I'm in my mid-30s right now, and I recently kind of jammed it, my knee, a couple months ago. It swelled up like a balloon. I couldn't do anything. I couldn't bend it. I couldn't move it. This is what prompted me to look into stem cells one more time. And the only reason I went through with the procedure was because I found out how to get it at a discounted price, which I'll go over with later in the video. I was fed up with these symptoms. Some days are better, some days are worse, but in general, it always hurts. Now, I really don't want to get surgery. I didn't have a good experience. I don't want to go down that road again. Removing things out of your body, from my research, you're never going to get it back. There's potential to heal these cartilage meniscus injuries, but you're not going to regrow it. What they've been doing in surgeries is just removing it. If you've had your meniscus removed, depending on how much, this might not be the right move for you. If you're going to get a repair done, you might as well get stem cells too for the best chance of healing. Now, tearing meniscus, from what I can tell, is pretty normal part of the aging process. Some people have really slightly tears in their meniscus and they feel no pain. But obviously I'm experiencing severe pain and it's not okay, and I'm trying to do something about it. Now, you also need to look into whether or not the meniscus tear is part of a bigger issue. Does your knee misalign? For example, if you have other injuries that make your knee move in an irregular way, that could be bad. Your body could be, misshapen, for lack of a better word, and you're more prone to this injury. That is why physical therapy before and after any sort of procedures is going to remain important. So I finally decided to go get another MRI, and sure enough, my meniscus was torn. I can't remember how bad it was in the past, but it was in the exact same place that it was before. And my only assumption is that it never actually healed. It's just been torn for 20 years. I had to drive pretty far, about an hour down to the city, to get a more affordable option. The MRI for my knee around my area was about $1,500. And I went down to the city and I got one of my knee for $450. That's without insurance. They were going to charge me more with insurance, playing that whole game. And from what I could tell, that was maybe not the lowest price, but pretty close to it. There are a few places around the country that offer stem cell injections. When I called them up to schedule a consultation, I asked if an MRI would be required, and in order to get an accurate diagnosis and correct procedure, an MRI would need to be done. So I wanted to know what was going on anyway, so I just went ahead and paid that $450 and got the MRI taken care of. That was pretty easy. I got it in a couple days, got the results. It took me longer to wait for this consultation. Got to the day of my consultation, took my MRI results with me. At the consultation, I talked to the doctor. They manipulated my knee. They talked to me about my past. They asked when I get pain, about this last injury I had where I jammed it, what happened. They hooked me up to an ultrasound machine and just looked at the knee area. They found tons of fluid in my knee, which I pretty much already knew because I have a hard time bending my knee all the way. But they did find that after looking at the MRI, I do have a very large tear in my meniscus. And with the fluid, the big issue that was present in the MRI was the meniscus, but they found that the fluid in my knee, that my ACL was loose, as they put it, along with my MCL, LCL. And with that ultrasound, they also found some early stages of arthritis. My bone is already deteriorating from the constant bone-on-bone contact. So pretty much my knee is not doing well. I can deal with the pain day to day, but when I think about my other knee, my good knee is fantastic. I literally have no pain there ever, no swelling, nothing. So I can kind of act like my injured knee doesn't bother me, but when I think about my good knee, it's obvious that I have severe problems going on. The lack of cartilage, rather the tear, it's also bulging out. So I get more bone on bone contact. The clinic I went to, they've been around a long time. They've been doing this actually for about 20 years. It's called Regenex. Like I said, the cost of this can be huge. So if you've been researching stem cells, you might have heard about PRP as well, platelet rich plasma. That has, again, stem cells and the PRP are not, there's not conclusive results that they actually are doing the things that they claim. But a lot of athletes get these procedures as there's anecdotal evidence that it helps. And the only reason I chose the Regenex clinic, there are a few different brands that do this now. Fortunately, the Regenex has been around for a long time. They have served many customers, but the cost of getting stem cells for me without insurance was going to be about $10,000. Now, I was almost willing to pay that $10,000, but through just very fortunate events, right about when I hurt my knee this last time, a few months ago, I started a new job and I had a benefits meeting. Now, stem cells and PRP are never included in traditional insurance plans. I don't know if anyone does. But in my benefits meeting, I found out that there was something special called corporate insurance policy, in which stem cells and or PRP injections are possible to be covered under this corporate insurance umbrella. Now, I know that's a little complicated, but I have basic health insurance, and basically under that health insurance was a special corporate deal in which you basically got this benefit. So the cost for the whole thing was going to be about $10,000 to $12,000 out of pocket. It ended up only costing $500. I'm just talking about this because you may want to seek out an employer that offers what would be called this corporate insurance plan. Now, this is going to be hard to find, but this was one of the driving factors of why I decided to pull the trigger. Like I said, I had been actually thinking about this for maybe 2, 3, 4 years, and just thought it was totally out of the picture. But the fact that this was a possibility for me now with such a low cost, I said, absolutely, let's try it. I'm willing to do it. Again, that's the only reason I went with this one clinic, because it was the only clinic that this policy was connected to. And I suggest doing some research, maybe calling different clinics, asking if they have special corporate sponsorship plans. So after the consultation, they take all the information, they make notes. They have to then send it off to kind of their corporate office or whatever and determine whether or not I was going to be a candidate for these procedures or not. It kind of seems like PRP, you're almost guaranteed to be qualified for. Good thing about PRP, I found out, is out of pocket, it's about $1,000. So if you can't afford the stem cell procedure and you want to give an injection a try, research PRP. It's basically supercharging the healing process. They take the platelet-rich plasma out of your blood, inject it into my knee. to hopefully speed up the healing process. PRP is just a blood draw. The stem cells that I got were taken from my blood marrow. They drew it out of my hip. They do that out of your back, the back side of your hip. They make 2 injection points and draw out the bone marrow. Before they get to that though, so I had, my MRI, then I got the consultation. I waited for their response as to whether or not I would be a good candidate. Sure enough, I qualified. Not a lot of people qualify for this insurance kind of scenario for stem cells. Sure enough, they wanted to try it on me. This is for lack of a better word, somewhat experimental. This isn't approved by insurance because of that reason. They can't say for sure whether or not it works, whether or not it doesn't. So after the consultation, I had to wait a few weeks because they're just booked out. But I had the MRI, quickly the consultation. I had to wait a few weeks to get my procedure, but right 2 days before the procedure, I had to go down for what's called a pre-injection. They're priming the area. It wasn't a big deal. I went down there. They made 3-4 injections all around my knee. After that, I did experience a little bit of pain. It did swell up a little bit, but I was able to drive home. 2 days later, I had to go down for what would be the actual stem cell procedure. Now, this was all done in 1 day. I had to fast before it because they are going to draw your blood. They drugged me up, all sorts of stuff. No anesthesia, but I was severely drugged up. I don't remember it. It wasn't painful. I was knocked out, but not through anesthesia. They drew the stem cells out of my back, rather my hip, my lower back, and I woke up, little bit of pain, super drowsy, had to go wait in the waiting room. A couple hours later, they prepared the stem cells through whatever process that is, went back into the injection room. They then made multiple injections into my knee, upwards of 10, 12, maybe even 15. The only reason I say that is because I saw the injection marks afterwards. These injections are very specific, so they put it into my meniscus, my ACL, my MCL, my LCL. And I even asked the doctor this before I went under that day, since he did see arthritis starting to form, if he could inject it into my bone. He said, that's a great idea. We're going to do that. It sounds like that wasn't really part of the plan, but they ended up doing it. After all this, I had to get a ride home. I couldn't drive myself because I was under the influence of so many drugs. I was in quite a bit of pain. We got stuck in traffic coming home, so I was in the car for about 4 hours, and it swelled up. The best way I can describe it, it swelled up like a cartoon. It was unreal how much it swelled up. I was in tremendous amount of pain once kind of the meds wore off. Luckily, they did give me a pain prescription, which I filled, took those. But even then, for about 3 days, it was super difficult to walk. They don't really want you to stay in bed, but at that point, you can't really do anything. Part of the reason I think it was so swollen was because they did actually inject it into my bone. I can't describe quite the feeling, but I was just in constant pain. I believe just from the amount of swelling that was happening, it was extremely painful. Part of the worst part was actually waking up in the morning, not having it elevated all night, and maybe having a little bit of pressure from my heel just on the bed. And it was tremendous amount of pain. If I needed the pain meds for the first week. After about 3 days, the swelling started to go down a little bit. So I had it done on a Thursday, and I went back to work on Monday. Those days of that week at work was not good. The swelling remained for about 2 weeks, but it slowly got better. And I mean, the first 3 days, it was huge. When I say the swelling went down, I was still pretty swollen. The amount of bruising, so they only injected it around my knee area, but I had bruising from my ankle all the way up to almost my waist on the inside of my leg. Tremendous amount of bruising, which was also another pain factor. Just, having that bruise is super painful. So I got the stem cells. 5 days later, I had the PRP procedure done, where they draw your blood, inject more into your knee. So hopefully, how they explained to me was that the stem cells are kind of like going to be the building blocks to hopefully fill any holes in my meniscus, help to build the tendons stronger, and that the PRP is basically like supercharging that. The PRP is designed to speed up the healing, to increase your body's response. All this swelling, all this bruising, I was told was completely normal, that's how your body's going to heal, and it's just activating the healing process. The PRP was quick, one single injection. It doesn't need to be as precise as the 15 stem cell injections. It just kind of spreads around, so I'm told. After that first week, swelling went down. After about 3 days, I could kind of walk, barely. After about 10 days, I started to bend my knee more. They really want you to keep it moving. You don't want to go running or anything crazy like that, but you need to bend your knee. And they just say, if it hurts, don't do it, but keep it moving as much as you can and slowly increase. So after about 10 days, life started to return to normal. Still pain, getting off the pain pills. You can't take any NSAID pain relievers, ibuprofen, 4 weeks before the procedure and 8 weeks after the procedure. Thank God you can take Tylenol though, which does help reduce the pain. I take some at this point whenever it starts to hurt. I'm about 3 weeks after the stem cell procedure now, about 2.5 weeks after the PRP and about 3 weeks after the stem cell procedure. My swelling has gone down almost all the way. I'd say my bruising is at about 10% of what it was now after being about 3 weeks. They'll give you a sheet of recommended supplements you can take, like turmeric. You want to get back on the fish oil, anything that can help the inflammation, but you cannot take ibuprofen. They stress that enough that can somehow affect what the stem cells are doing to heal your body. So they told me 3 days, you're going to be in a lot of pain, a lot of swelling. 1 to 2 weeks is going to be difficult, but you'll get back into the swing of things. Don't do anything. No running, no high impact activity. You should avoid repeated stair stepping. After about 3 to 6 weeks after the procedure, you can kind of start to rehab using pain as a guide. They say if anything hurts more than a 2, don't do it. You've overdone it. 2 out of 10, that is. 3 to 6 weeks, you're slowly bending it more. You're doing those rehab exercises. You're trying to bend it. The movement you want to keep doing. You can start to walk more. After 6 weeks, they said you should potentially be able to start returning back to your activity. For example, if you were a runner, I'm not. I'm not going to be doing any running, but you want to start at about 10% of what you were doing. So say you ran 5 miles a day, start running a half mile. Assess the pain and go from there. You want to slowly increase that 10 or 20% each week. That's after about week 6 to week 12. And then hopefully by week 12, you're kind of getting back into what you were doing. They mentioned that after week 12, up to about 6 months after, that's when a lot of healing is taking place. So these building blocks kind of build their structure, and then they tear it down and then build it again. And that's going to keep going. They told me up to a year. Some people will go back after a year and get what's called a touch-up, another injection. But with cost being the way it is, I don't see myself doing that. I could potentially go back to get PRP. I don't plan on getting more stem cells unless I better see a big improvement if I want to go get another dose of this. I'm 3 weeks out. I'll hopefully make a video down the road kind of explaining the hopefully full effects of what I've experienced and hopefully feel a lot better. I just wanted to make this video to kind of explain my experience. I can't say that I'm seeing any results yet because I'm kind of just getting over the trauma of the procedure, but hopefully there were some tips in here to help you on your road to recovery. I hadn't seen many videos like this explaining what to expect. A couple other side notes, you kind of notice that this procedure seems to be for either athletes or older people or people that get surgery and combine with this. So I'm hoping that because my injury wasn't severe, I was still able to do the things I want, I just couldn't do it full 100%, is that I do experience some severe relief, and I hope I can rebuild my knee to what it once was, or even better than it once was. If you have any questions about this procedure, feel free to leave a comment. And you don't have to go to the clinic that I mentioned. I just wanted to talk about the one that I went to. They've been through this with many people before. It wasn't too complicated, and compared to surgery, these processes are much less invasive. I just don't want surgery. I don't think removing anything, cutting anything is going to help my situation. That's why I've been taking the supplements. I've been trying to rebuild from within, and this was the logical step for me.